I'm not the expert. You heard from the expert. I'm the program lead for patient and citizen engagement at the Canadian Foundation for Healthcare Improvement. And we're just going to pop up the PowerPoint. Oh, okay, there it is. So I'll tell you a little bit about my organization in a second, but first of all, we have very little time, and I'm between you and lunch. And I do want us to get talking a little bit, so I'm just going to state a little bit what we're going to do. Before we get talking, I'd like to just introduce very briefly the concept. So what do we mean by patient engagement? And right away I'm going to say, I'm saying patient engagement because I've been in the context of a lot of patient engagement in the projects that I've supported. But a lot of people may opt to say client engagement or family engagement or customer engagement. So language is important. I used to downplay it, but it is important because people who are going to be part of your process need to feel that they are a part of the process. And so if they don't like being called patients, then by all means, call them what they want to be called, and that might require a conversation. So we're just going to clarify the concepts, and then we're going to identify challenges and opportunities, benefits of engaging the people you're trying to serve. We're going to talk about that briefly, and then I'm going to try to provide an overview of some of the foundations of meaningful engagement. Why I say I'm not an expert, I've spent the past 2 years only really learning about this, and I've learned this through observation. So the Canadian Foundation for Healthcare Improvement is a not-for-profit organization funded by the Government of Canada, and we work with improvement leaders across the country. So we used to work with a lot of researchers, and our programs have been geared more and more in the past couple of years working with decision makers. So we have the executive training for research application. Actually, those leaders meet in this very room a couple of times a year. And that program works with teams of people in health delivery organizations or policy organizations to apply research towards intervention projects that will lead to improvements. The other cluster of programs that we support are collaborations. So collaborations are very similar, but they are within a region, and there are several teams working across jurisdiction on a similar type of problem or issue or something they want to improve. The Patient Engagement Projects Initiative was started in 2010, and what we did was say, we believe that there is a potential to engage patients and families towards quality improvement. But there isn't a lot of evidence to support that. And so can we support organizations and begin to create an evidence base for not just whether or not engaging patients and families can lead to improvements, but how might that lead to improvement and how do we go about doing that? So I'm a learner because we're only 2 or 3 years in. And the other thing that I have to say that we started in 2010, we provided funding to organizations that submitted their proposals, but only one of the initial 10 had engaged patients and families in identifying what strategies they would use to engage patients and families. So right away, I'm telling you, we've learned a lot. And, oh, I'm sorry, gee. Maybe I should lower this so that okay. I'll step this way. So there was a little bit of a weakness in what we've set up. And congratulations to you all because you have the opportunity right now to stop and say, okay, we're thinking about what we might do. You have an opportunity to take a step back and think about ways that you might engage your clients in identifying what the objectives might be and then what the solutions might look like. So, moving on, the concepts. I'm not going to spend a lot of time about patient-centered care, patient and family-centered care, only to say that a lot of people use that term, but we don't always know exactly what it means. And so everybody will agree that it's the right thing to do. But when we move into how to operationalize that, sometimes we get lost, and sometimes it gets lost. So it stays in a vision statement, but it doesn't get felt throughout our organizations, in our services, and our interactions with people. So we have adopted, or I use frequently, the description provided by the Institute for Family and Patient-Centered Care, which is based in the United States and have been working many, many years with healthcare organizations into engaging patients, partnering with patients and families. So they have identified a couple of key concepts, moving from basic respect to collaborating, partnering with patients and families. So really important when we're talking about patient-centered care to be really clear about what we mean. The other expression or concept that gets kicked around a lot is that of patient experience. So when we're looking at the quality improvement mechanisms within organizations, often we'll look at how we're improving the patient experience, and that might be through different dimensions of quality. I am here to suggest that unless there are formal mechanisms beyond satisfaction surveys, that I'm not sure we can really get at understanding the patient experience. And therefore, and again, we didn't have, I'm not going to go that way, we didn't have at the beginning a working definition of patient engagement. We said to the teams that for which we provided support, you tell us what that definition is so that we can sell it to the rest of the world. And they came with many different definitions that made sense for them in their particular context. I've found this is one of the most useful definitions. It's from an article that many of you might find very useful, written by Tam Beiser, and it's actually somebody who works in the field of mental health care. He says one size does not fit all. So he offers us a definition that tells us it's partnering with patients and recognizing the expertise of the patient or the client. And it could be throughout a range of activities. So let's talk about that a little bit more. So before we get into that, I just want to, and we talked about it a little bit this morning, when we think of what are the benefits. So why would we engage with patients and families? Why would we engage with the people that for which we're trying to improve the services? So I'm putting that question out to you, but because we're a little short on time, I'm going to ask you two questions, and I'm going to ask you to discuss them at your table groups, and then maybe we'll ask a couple of people to give us the highlights of those discussions. So the first question will be, so what are the benefits? What are the potential benefits of engaging patients and families, clients? And then the other question I'd like you to think about is, what are the challenges? So maybe they're not challenges for you, but what are the challenges of either you or maybe some of your colleagues of why they're not? What's preventing them from engaging with patients and families? So I'll give you, how about we give you like 3 minutes? Okay, so we're only gonna hear from 2 people. So so people who think they've got a really good benefit in your particular context, just think about that. We're gonna take one. No benefits. Okay, we've got one here. Thank God. That would have looked really bad.
What we came up with here is that we used the example mainly of young people, but I guess it can be for anyone, that it's just so empowering for them, and they're more likely to follow through with their care plan if they're there to help voice their opinion, or with their family there. And also there's so many barriers, especially with some people, that you may not know when, for example, doing a care plan, like what if the young person, just for example, like what if they aren't at home? So that can be a huge barrier to certain things, or whether or not they're in school. So there are just so many factors that you really may not know without actually talking to them and getting their view on everything.
So we've got 2 benefits there. The first one is empowerment, which might potentially lead to improved health outcomes. That's actually 2 right there. And then you've got another one, more insight into what the lived experience is. Or are we going to take another benefit? I guess we can.
It doesn't really speak to benefit. It actually speaks to the question.
Yeah.
And to me, every time I see this question as a parent and as a person that really does engage families in this country, to me, I can't believe that we're even asking what are some of the possible benefits, because to me, it's not even a question.
Thank you very much for that. Absolutely. When we started, we launched the Patient Engagement Projects Initiative. And, you know, we got together the 10 initial teams and we were like, rah, rah, we're gonna show how engaging patients and families will lead to quality improvement, and we've got to figure out how to do that, and therefore you need to have really solid evaluation components within your projects. And it got really serious, and one guy stood up, actually one guy who was able to show tremendous benefits at the end of his project, but he said, but we're doing this because it's the right thing to do. That's it. And Bev Johnson, the CEO of the Institute for Family and Patient-Centered Care, like, it's the thing, right? CEOs, decision makers are like, okay, well, tell us what those benefits are, you know, like, and Bev Johnson will say the same thing. She works very hard with people to help them understand why we do it. But in the end, she says, you shouldn't have to prove this to anybody. And you're right. So thanks for that. There are people funders, governments, politicians, bureaucrats, people are driven, sometimes we forget, right? We forget that gut feeling about what the right thing to do is, sometimes gets lost in the busyness, in the paperwork, in all of the demands and pressures. So there's a lot of things that we may have to draw from to try to demonstrate and get buy-in from multiple groups. So it could be the principle-based value, this is the right thing to do, and therefore we're going to do it, regardless of what the outcome will be. There's the therapeutic value, you know, it's good for people. If we have a better understanding, we can provide better services, enhance quality, the politics, increased efficiencies. We've got one program that is demonstrating, actually it's here in Montreal at the McGill University Health Centre. They use a quality improvement tool out of IHI in the States called Transforming Care at the Bedside, which is a quality improvement methodology similar to Lean. And what they did is they took that, but instead of just training frontline staff in these small tests of change and PDSA cycles, they brought patients and families and staff together to get training in quality improvement. And what it resulted was an incredible buzz, an organizational culture that got created about mutual understanding between patients and staff and what they were each living, but also people that were very empowered to identify how we can improve our services and how we're going to implement this and what are we going to do next. And they were able to demonstrate incredible savings in the system because of that engagement. And then there's another reason a lot of us would say, well, in Canada, we don't worry about that. We're not trying to attract customers, except that in your particular circumstance, maybe you want to attract your customers because they're not accessing the services that they should be accessing in a timely manner. So all of the reasons are good, and I agree. We should be grounded on the principle that this is the right thing to do. We didn't talk to the challenges, but we'll get back to that in a second. Actually, no. While you're still got it in your minds, were there a couple of challenges that were raised in terms of things that prevent you? Yep. Oh, we've got a need for a mic here.
These may seem like probably very obvious challenges, but one initially, as a parent, navigating the system, even though I work in the system, or had worked in the system, and probably the biggest one is being invited to be part of the process. Oftentimes, I recall several where I was excluded from the process without opportunity to enter, and that's just surprising this day and age when we just mentioned that family engagement should be part, and it adds to the enhancement of everything. So that's still a challenge. I don't think all service providers provide open doors for parents to be involved, especially when a child's 16 and the information sharing challenges.
Yeah. And we'll take. Here and then there.
I would hope that we'd be well beyond inclusion and just the invitation. And what I find often is that we invite people to come and join in our conversation based on our rules and our timelines and our processes, while rather than being willing to change who we are and our culture to be more empowering, meaningful participation of young people and families. That's a real barrier because we're willing to have them come and change, but are we willing to change our processes to make them feel that it's going to be meaningful?
And then we'll take one last challenge.
Thank you. I agree with what was just said. I want to go back to that idea of because it's the right thing to do. I think we need to be more formal about that. For instance, the residential school policy around children was the right thing to do at the time, right? That was a policy that the government said that was the right thing to do. Our child welfare system, the way that it works of taking children into care, some of these kids are bounced around. I've met people 20, 30, 40 times as children. That is still seen to be the right thing to do. And I think we need to be more, we need to push that further and I think formalize it and to really, I said yesterday, this idea, and it was, I think it was Louise, who said we need to take a more formalized human rights approach to this, and we really need to start to question what is taken for granted as the right thing to do as we move forward. So that's the one thing I would say, because it's certainly in the name of Indigenous people in this country, there have been many right things that have been done that have not had very positive outcomes.
Yeah, thanks for that. So I'm showing another, actually this is also from the same article, that Tam Beiser article, that one size doesn't fit all. And when I saw this, this was an aha moment for me because last fall we were at the end of a 2-year cycle for our first cohort. And we got final reports from that initial cohort, and only one of the 10 projects were able to demonstrate in a statistically significant way, I'm not a researcher, but I like using those words, improvements at this level in terms of outcomes, even short-term outcomes. And I got depressed. I'm like, I've been on this project for 2 years and we don't have anything to show. And my CEO and my VP are like, Mireille, we really have to get out the gate with, the evidence. And I'm like, it's not there. And I was really scared. And then I started looking at the projects a little bit more and reading the reports from just somebody who is listening to the story. And as I started talking to the decision makers and researchers and patients and families that were part of the projects, they were like excited. They're like, this has been fantastic. This has been the best project I've been involved in. And I'm like, well, but it didn't lead to any real results. And they were like, no, not at all, actually. In terms of the way we do things in our organizations, things have changed. There's a buzz around this. People are excited about what we're doing. Staff members feel more engaged in terms of the services that they're providing. So there was something going on in terms of organizational impacts that we weren't necessarily seeing in those results. And so I got a little bit more encouraged. And then I read, this article came across my desk, and I was like, it speaks to the story itself, because in a 2-year time frame, and you're saying it for a 5-year time frame, it's really, really hard to get, to jump all of a sudden to this end of the spectrum, because in order for us to get here, we have to make sure that the proper ingredients are in place. So we're not just going to throw somebody on an advisory council and say, here we go. We need to identify, do those people have the education and the support and information they need to contribute in a meaningful way? Are staff bought into this? Are they really going to listen? Are they going to be able to change the way, and you alluded to that. Is there going to be transformation on both sides? Are we just doing this because it's the right thing to do, and yeah, we're going to listen and then we're going to do our work? So there's a lot that has to be done working towards the determinants of meaningful and effective engagement. And then there's a lot of just good project management, listening to what's the context, who else needs to be engaged, who do I need to tell about this? How am I going to, if I'm collecting data on something, is there somebody else in the organization that's collecting similar data, or can I talk to them? And could we together create something that can meet both purposes? So all of that, I mean, there's really, diversity issues. Are we hearing from the right people? Have we done any formal recruitment, or have we just, taken whoever picks somebody out of a hat? So there's a lot of really key questions, and we can't get into too many of them, but I will identify a couple of resources to help get you kick-started into identifying some of those ingredients for successful engagement. So that was the question we were going to ask. Now we're just going to move into, and I'll try to keep it to 5 minutes. So foundations for meaningful and effective engagement. We talked about values and principles earlier, but also not just in terms of where we are grounded and what motivates us, but in the process of engaging patients and families, there needs to be a mechanism that helps people, whether it be decision makers, research, whoever is at the table, whatever hat they're wearing, there needs to be a process that helps people identify from a values-based perspective that the process is meaningful for them. So there's an exercise. I just came back from, we're partnering with the North Shore Tribal Council to look at redesigning their health service delivery model to be more customer focused. And we're talking about community engagement. And it's a struggle because there's resistance to engage members of the community because the service providers see themselves as being members of the community. So we just want it to be ours. We don't necessarily have to engage our community members. So it's been a little bit challenging, but through conversation, we found a way to at least initially bring a couple members of the community to the table. And then so we started looking at foundations for meaningful engagement. And one of the activities we did is try to think of an iceberg. Like, we use the analogy of the iceberg for a whole bunch of different things. But where you've got, the visible portion, so people's positions, the stances they take, and then below that you start seeing, the interests that they have and the way, like what they speak to and how they speak. But when you're able to hear that from multiple perspectives, you get down to that foundational piece, and very often at that values base, there's something in common in that. And so when you're thinking about your projects, and when you're starting to engage different stakeholders, if you can think of a mechanism for taking the time to identify, so what's important to you in this? Like, why are you at the table? Like, what are you interested in hearing? You'll have this, we're this very, broad statement, but starting to ask people what's in it for you, like what's important for you in this, and getting at that foundational piece, and then you can come up with a tagline that makes sense for everybody. And I did it, I had the privilege of sitting, they wanted to separate themselves. Decision makers, like the directors, health center directors, staff members, and community members. And I was like, oh, here we go. But it was actually quite good because the community members brought out, they wanted to talk about, the members of the community that were getting services on the reserve and those that were going off reserve to get their services. And there was this like tension between those two. So we were trying to understand, and I wish I had been insightful enough to throw a picture, because I took a picture of the two icebergs and what we created in terms of what the position is, no to health services within the community, and then yes, and then break it down in terms of what are the interests of people. And fundamentally, we came to a place where they identified that people going off reserve, they were disillusioned. They didn't think that the services that were offered on reserve were as good quality as what they could get elsewhere. So there was this value of like self-sufficiency, whereas the community, they wanted like an empowered, healthy community. And empowerment and self-sufficiency sometimes you start seeing the overlap. And they came up with a decision statement that we'll get to in a second, and then a tagline. And that tagline, as soon as everybody heard it, because in our conversation, the word care came. The elders are saying, but we know how to care for our people. We've done it for centuries. And it's part of our values. So we came up with a tagline, care for better care. And it sounds trivial, but then to the rest of the crowd, when they heard it, it meant something to them. So anyway, it's values-based. Decision orientation, that just means, like I said earlier, we're not just inviting people to the table because we want to hear their perspective or we want to listen to them. It's beyond that. That we believe, fundamentally, that what they have to say is going to change the course of it's going to help us make a decision. It's going to help us guide the way in terms of implementing something that's going to look different. So there needs to be that decision orientation. And then the other foundational piece, and then I'm going to move on, and I'm not going to speak too much on this because there's a lot to say on this, but it's a tool. I'll actually leave you. I brought a couple of copies, I think just 30 copies, but I'll show you. You can go to the International Association for Public Participation. Is an international organization. It's got chapters in various countries. It's got a chapter in Canada, and you can go to their website, and there's a number of resources that help people work through developing a good engagement within their projects. And one of them is a spectrum. So understanding that, we have to be clear on, first of all, what are we trying to achieve, what the objectives are, and then when you think of at what level and what we're expecting of patients and families, we have to be clear too. Are we just wanting to provide information? And I saw in the descriptions of your projects that some of you identified that in your objectives, is to inform people, educate people around mental health. And so that's one level of engagement. And then you move across the spectrum where you're consulting, involving people, collaborating, so partnering with people to empowering people. And the other thing I want to say on this is that when you start to identify what level is appropriate to help you meet the objectives of the work that you're trying to do, the other thing to remember is that there's also a promise in that. So if you're engaging people at a certain level, you've got to commit to, there's a promise back to patients and families and clients about we're going to engage you in this way, and we will, and there's a promise there. So you can't read it now, but I will provide hard copies, and you can get this on the IAP2 website. So there's a lot of different continuums and spectrums out there. There's one that's more research-based. I like the IAP2 one because it's very practical. It helps you really get thinking about a very specific project. The researcher Baton Robert out of the UK came out with this other spectrum, and in the UK they work a lot on experience-based design. So he looked at it from there, and the researchers that are working with us, because alongside 17 implementation projects, we also have a research team. The principal investigator is Ross Baker. That team, one of their research components is to do a qualitative analysis of all the 17 projects. And the person, Anu McIntosh Murray, what she did is she placed the teams along that spectrum. So my point was that I used to think that projects that were just informing their public were less important, less significant, less meaningful than the projects that were really partnering with patients. And what I've come to understand in reading about the projects and seeing the process unfolding is that what's important is that your mechanism, the level of engagement, there's a congruency between that and the objectives and the promise back to the patient and the community. So we can talk a long time on that, but I do want to get one more question out, and then after that, I've got a couple of overall slides on the results that we've seen, but I think more importantly, if you could take some time before lunch, and how much time do we
No,
have?
we're at lunch now, Mireille, so I'd rather we didn't.
So maybe I'll just put that out there.
Yeah, I think so. That's.
And I think that'll be part of your discussion this afternoon is what is it going to take for the network to build a culture of engagement in efforts to transform youth mental health services. So you might want to jot that question down just so you don't forget it, so that when you're thinking about what is it that we're trying to achieve within that, and how are we going to engage people in that. And then I'm just going to take, if you'll permit me, just a couple of, so I mentioned it before, I read these 10 projects, and I'm about to receive the 7 other final reports from the 17s that started in 2011. So what we're seeing is that, yes, we are beginning to see improvements, definitely to engagement itself. So a lot of the projects realized that they couldn't jump right to those quality improvement, hardcore quality improvement initiatives. They needed to work on the determinants of meaningful and successful engagement. And we see that, you know, people have come away more empowered and more able to contribute to healthcare improvement. Improvements to the patient experience I talked about, and organizational impacts I've talked about. So one, overall lessons learned. We gathered the 10 initial projects for our final workshop last spring. And what we asked of them was, because remember, we didn't want to just see if it led to quality improvement. We wanted to understand how. So what we asked them to do, in addition to they had evaluation built into the implementation of their projects, but we also asked them to do a little bit of outcome mapping throughout the project. So we asked them to identify for us at the beginning and in the middle, so what are the behaviors? Like you've defined patient engagement in your particular context. We asked them, what behaviors are you going to see from your different boundary partners, so whether it be decision makers, families, youth, like the different stakeholders, what behaviors are you going to see from those people in the short term? So what do you expect to see very quickly? What would you like to see? So as this project is emerging, what behaviors would you like to see? And then in the long term, what would you love to see if this goes really, really well? So it helped them break down, not just because we tend to jump to that love to see and forget to really think about that expect to see and like to see. And if the expect to see is not happening, God help you, you're not going to get to the love to see. So it helped them break it down in that way. So what we did at the end is ask them to bring to us in a final workshop 4 promising practices that helped their projects be successful. And so we had this 2-day process, and it was a crazy process. I don't recommend you try to do this at home in 2 days especially. But 10 teams presented 4 promising practices, and then we had this crazy process where we smushed that into, I think we created 5 briefs that focused on different themes, and we call them ingredients for successful engagement. A lot of people read them and say, duh, like this isn't so significant, but people who are trying to do patient and family engagement or trying to partner with patients and families, when they read those briefs, they said, oh, I didn't think about that, or I didn't, like really simple things. So I will provide that. You can go to our website, CFHI, those briefs are available. We have videos of, I think, 6 patient engagement projects. So we took video footage and a little bit of the story of what they did, what results they achieved. We've got some impact stories. And then the last thing, I was invited to come here because Catherine saw a presentation by a colleague and the researcher, the principal investigator, Ross Baker, and there were 3 decision maker leads as well as a patient rep who was involved in that presentation. They presented at Casper a couple of weeks ago. So I got the audio, and one of my colleagues was able to sync the audio and the Prezi that they used. And we're going to put it up on our website. So I will provide a link within that presentation. One of the projects that is presented is in Alberta. There's a group of people that have embedded, and probably the people who are part of the Strategic Clinical Network for Mental Health are aware of the patient engagement researchers. So they decided to try with the osteoarthritis Strategic Clinical Network to embed patient researchers within, it's a quality improvement body within Alberta, and they're broken up by area, clinical area. And then they got asked, they started with 1, and they got asked to embed patients as researchers in 7 other strategic clinical networks. So I don't know how Tracy is doing with that, but I think that it's seen as being very promising, and she describes what it means. what it has meant to them. And there's some video footage of patients talking about what it has meant for them as well. So I'm going to stop there, take a breath, and good luck just continuing talking and creating this. Looking forward to it.